In debates and on the news, when it comes to the new healthcare law, the Republican presidential candidates have one thing in mind.
My plan for ObamaCare, if you go to newt.org, the very first thing under the Contract with America is to repeal it.
What's so bad about the new law? The candidates say that it will destroy jobs, raise taxes, infringe on religious freedom, increase the deficit, and give the federal government too much power over the healthcare industry. Rick Santorum tells CafeMom that his opposition to the new law is even more personal.
One of the reasons I'm concerned about Obamacare and government-run healthcare is that we tend to use, and you hear about this, cost-effectiveness research. We hear about, proper utilization of resources. When I hear things like that, as a dad of a special needs child, the bells and whistles and red flags go up. That means that my child has to earn care, has to be worthy of care, has to be a good investment for care.
It's an election year, and healthcare reform has become a major hot-button issue. So much so that it's getting hard to tell what the truth is and what's just political rhetoric. That's why I've come to New York City today to talk to some experts and find out what this new healthcare law really means to you.
As usual, there's a lot of misinformation about the law.
Miriam Lageson is an assistant professor of health policy and management at Columbia University's Mailman School of Public Health. She studied the new healthcare law closely and says Americans don't need to panic.
Will people who are happy with their insurance right now be mostly unaffected? Yes, they will be mostly unaffected by these provisions.
The new law requires every American to have health insurance by 2014. Critics warn this will make healthcare costs skyrocket, but Professor Lageson disagrees.
We are already paying for other people anyway. We're paying for it through higher rates of ER visits for people that are uninsured, and by the time they get to that situation have gone past the point of prevention and are sort of literally in a crisis situation because they haven't been able to get primary care, they haven't been able to go and see a doctor.
Passed in 2010, the Affordable Care Act is rolling out in phases over a 4-year period. Here's what's already gone into effect. Young adults can now stay on their parents' plan until they turn 26 if their own employer doesn't offer health insurance. All new plans must cover preventive services like mammograms and colonoscopies without charging a deductible or copay. Children can't be denied insurance due to a pre-existing condition. New incentives for primary care doctors and nurses working in underserved areas include funding for scholarships and loan repayments. Anna Benyo is a senior health policy analyst at the National Women's Law Center. She says by 2014, the law will cover even more adults who currently can't get insurance.
They can't be denied for a pre-existing condition. They cannot be denied care once they get sick. They can't be dropped from coverage. There's a guarantee that you will be able to obtain coverage.
Other new provisions on the horizon include affordable insurance exchanges, allowing individuals and small businesses to choose their insurance plans from a range of affordable options. No annual dollar limits on the amount of coverage that individuals can receive. And the new law bans insurance companies from charging higher rates due to gender or health status. Benyo says women in particular will notice some significant changes in the next few years.
Women's preventive health services is a part of the law that we think is really just sort of a game changer and will provide women with access to contraception, all of the FDA-approved methods, so that could be the ring, it could be the patch, it could be the pill, it could be the IUD, whichever form is most appropriate for you, and no cost sharing, no copay, no deductible, nothing like that. We think this is a huge step forward for women.
Beyond Republican opposition to this new law, there's another rub. Next month, the Supreme Court will hear arguments that the law is unconstitutional. The court's decision could change everything.
They can strike the whole law down. They can uphold the entire law and say the entire law is constitutional. They can pick a certain piece of the law and say that part's not constitutional. To the extent that they're going to pull apart pieces, we don't know.
Whether or not you agree with the new law, the changes already in effect can potentially have a big impact on moms and their families. To stay informed, the experts recommend 2 websites. Healthcare.gov explains the new law from the government's perspective in clear, easy-to-understand terms. And the Kaiser Family Foundation offers a non-biased, in-depth look at healthcare reform. You can find that site at healthcare.kff.org. For CafeMom, I'm Lindsay Ferrier.